So let's talk about your chapter 16. Okay, we're going to start learning about bed making. As you guys have already learned some bed making skills, which we will kind of reiterate this chapter, but let's start on chapter 16. Okay, so it is very important for your residents to have clean, dry, and wrinkle-free linens on their bed, because not only is it more comfortable, but we also worry about skin breakdown, pressure ulcers, things like that. When you have patients who have very limited mobility and it's wrinkled up and creased underneath their bodies. I don't know if you guys have ever woken up and had like your pillowcase, like you wake up, you have marks on your face from a pillowcase or something on your bed. Well, you have young, good skin, they do not. So if they are at risk for skin breakdown anyway, and they don't have a nice flat surface, and they're more at risk for skin breakdown. So that's why we make their beds every day. And we also straighten their rooms and make everything tidy and neat and it looks good whenever they have visitors, so they don't have to be embarrassed about the shape of their room. Now, in order to keep the beds neat and clean, of course you're going to straighten them whenever they're loose or wrinkles. That could be any time during the day. You're also going to want to do it at bedtime, because we know that during the night they're going to be in bed for hopefully at least 8 hours. So we're really very particular about that for the residents who are up during the day but sleep at night. So make sure you check and remove any food crumbs. Okay, a lot of these people, especially maybe at breakfast time, they don't feel like getting up and going to the dining room. And if they don't, or you guys have already figured out, you pass snacks during the day. Okay, they may eat in their bed or around their bed, and we don't want that food and stuff and crumbs in their bed. So make sure you remove anything like that. Look for dentures, glasses, hearing aids, any kind of a sharp object even. Unfortunately, I've seen needles that nurses have left in the bed. People pick up really bad habits, okay? So make sure you check that bed for any and everything that could possibly be in the bed. And then you change it, of course, when they become wet or soiled or damp. A lot of these patients take, like what they call them, water pills. We call them diuretics, because they have a lot of swelling. Well, when you take a diuretic, it makes you pee constantly in large amounts. So sometimes if they can't get up in time, and they wet their bed, it may even go past their pad. Or if they're not positioned right on that pad that you lay under them, they could wet the linen, so obviously you're going to change it then. And again, you always follow standard precautions and blood-borne pathogen standards when you're changing linen that could be soiled, because we know, especially if you have a younger female patient, there could be blood, okay, when they have their period. Okay, sometimes older patients have hemorrhoids, and you'll see fresh blood in their stool. So there is that possibility. So I always take all the precautions that we need to take. Now, let's talk about the different types of beds that you will need to be familiar with. First, we have a closed bed. A closed bed is something that you use when you have a patient that is very mobile. They're going to be up all day long, going to meals, activities, and things like that, and they're not even going to use their bed until they go to bed at night. So a closed bed is something you use for a patient who does not go to bed until nighttime. And again, it would also be something that you would use if you have a new resident being admitted into the facility. You'd have a closed bed, and that means everything is pulled up and nice and neat, like you would leave your bed at home. Okay. Now, an open bed is when we talk about the fan folding. We learned a little bit about this. You're going to kind of fold the top of it back, and it's going to be for a resident who's going to be in and out of the bed more often. So the top linens are fan folded back, so it's very easy for them to get into the bed, and all they have to do is take that top part of the cover and pull it up and cover themselves with it. Okay, so it is open. Occupied bed, of course, means that you have a resident in the bed. You will have some bedridden residents who don't get up. So sometimes you may have to make an occupied bed. And then you have a surgical bed. And no, we're not going to use this as much in long-term care, but you would use it in a hospital. So if you have a surgical bed, that means you're going to be transferring a person from a stretcher, and which you may use occasionally if you have to send someone to the hospital. And then you have the patients who come back. They always arrive per ambulance. They're going to be on a stretcher, but this is going to be your least used skill. Doesn't mean you won't use it, but least used, okay? But in a hospital, you're going to use this really often, okay? Now, if the linens are not dirty or soiled, we don't necessarily change them every day, okay? Usually you do it at least when you give them a bath, and how often is that? Twice a week. So we will do a complete bed change at least twice a week, as long as it's not, you know, dirty or soiled, or you have another reason to change it. But usually that's going to be twice a week in everything that we see here. Pillowcases, top and bottom sheets, draw sheets, things like that, again, twice a week. Now, we have talked about that if they are damp, soiled, or very wrinkled, we are going to change those linens. And when you're handling those, you have to make sure you're practicing medical asepsis, okay? So make sure you're holding those linens away from you. Because again, if they have urine on them, things like that, if you hold it close to you, it's gonna, your dry shirt will act as a wick and pull that liquid onto you. And you don't want to go into another person's room with someone else's urine on your shirt, okay? So make sure you hold it away from your uniform. Don't shake, but you'll learn that really quick when poop balls come out. So never shake them. But again, put the clean linens on a clean surface. Okay, you never come in there and throw the linens down on the floor and then pick them up to come and change the bed. Okay, if you have clean linens, you've just got it from laundry, you come in there and set it on a clean table before you change. Now, when you go to get your linens, try to make sure you get everything you need before you go into the room. You don't want to be running back and forth, so make sure you get everything you need, but don't bring extras. And that will be a bad habit you will learn, because they do it all the time, bringing a bunch of extra linens. But once you put the extra linens into their room, you can't take it anywhere else. And the room starts looking cluttered because you got all this extra linen sitting in there. So only bring what you need. Now, the way that you do it to make it easier on yourself is you start with the last thing you're going to need, but you get it first to put it on the bottom of the pile. And you work backwards. So that when you're ready to change that bed, the very first thing you need is on top. The second thing you need is under that. The third thing you need is under that, okay? Pick it, collect it, and put it in a way that all you have to do is grab what's on top. Okay, make it easy on yourself. Now, make sure that you remove the dirty linens one piece at a time. You always roll away from you so that you don't splatter or get anything onto your uniform or yourself. And you want to make sure that the side that touches the person is on the inside. So you're going to kind of roll it forward, okay, to keep all the dirty stuff on the inside whenever you're rolling those linens, okay? Can you pause that?